one thing everybody has a question about, it's kind of the culture in jiu-jitsu that when somebody gets choked out in competition or at the gym, they flip them over and then they lift their legs really quick. And they're like, oh, you gotta lift the legs. It's gonna, that's gonna help them out. It's gonna fix them. If you can touch on that a little bit and just kind of maybe even the receptors in the neck, because I know that kind of plays a role in how in the vessels to how the blood returns back to the brain, and the timing as well, like how long usually if there's somebody gets choked out, like how long does it usually take for them to come to?
In terms of the lifting the legs and increasing the blood return, I think that comes from actually an old test that we use in the ICU back from before we had all the fancy monitors that we have now. Is that we used to do, and I sometimes still do, a test called a straight leg raise, where a patient's laying flat in bed and you lift their legs up and see if that improves their blood pressure. So if somebody has a low blood pressure, by lifting their legs up, you use gravity to help return blood back to the heart through the veins. And so if the reason somebody's blood pressure is low is that their blood volume is low, they've been bleeding or they're dehydrated, that increased blood return from their legs can bring their blood pressure up. And that's a sign, if they respond, that the reason their blood pressure is low is low blood volume or dehydration, versus if it's a problem with their heart, like their heart's not beating very well, like they had a heart attack, then the increased blood volume won't affect their blood pressure very much. They already have plenty of blood volume. It's their heart that's not working.
Okay.
And so that's probably where that idea comes from. It probably honestly doesn't make too much difference after somebody's been choked. They already have a normal blood volume. So, getting it back to their heart a little bit faster to pump back out probably doesn't make much difference. It's not going to hurt. It doesn't hurt to do it, but it probably doesn't make a huge difference in terms of how fast they wake up.
Okay. I know, like, one thought I have, because sometimes, after somebody's choked out, they kind of, it almost looks like a seizure or something, or like, they kind of like convulse for a moment. And my thoughts are, if it really doesn't make a difference, like, could it be better maybe to kind of clear the space? I think we talked about this too, and like just clear the space and just let them wake up and then go up to them and say, hey, are you okay? Just make sure maybe their airway is not occluded or something, that kind of thing. But
yeah, I think that's reasonable too, is like you said, is, making sure that their airway is not obstructed for some reason. Although in most people that are healthy enough to be doing martial arts, it wouldn't be. That's more in overweight people. But definitely just let them wake up and then check in, make sure they're doing okay, make sure they're not having any numbness, tingling, inability to move anything, and that there isn't some bigger problem going on, but usually there won't be.